So how someone with migraine gets to specialty care can vary so much by their health plan, their health setting. Are they in a situation where they're going to a private practice? Are they in a large healthcare center or healthcare setting where it's required to go through steps through primary care? Can they choose right to go to specialty care on their own? So we see people arrive at neurology care through a variety of routes, and that's fine. A lot of times people make pretty good decisions about whether they need to go to neurology or primary care just by assessing their own level of attack severity and frequency, and how well they've done with previous treatments. I think that primary care providers, again, can handle the appropriate comprehensive care of someone with migraine, including the lifestyle, education, acute and preventive therapy kind of levels of care. But there are several points where it does seem that a referral may be warranted. That may be comorbidities, which make treatment more complicating. It may be someone who's quite refractory to a range of treatments they've tried in the acute and the preventive space, either due to lack of efficacy or tolerability and side effect issues. Certainly if someone's having a very high degree of disability, or their treatment is not optimized, that may also be the right person to refer. And so primary care providers who tend to have a very limited amount of time may want to refer also because a neurologist or a specialty care provider may have more time just for conversations, education, careful assessment both of diagnosis and treatment planning, and may be able to schedule those follow-ups on a regular basis, which is so important for optimizing migraine care. Sometimes patients may really be in need of specialty care, but access is just limited due to geography and pure numbers of people with migraine versus our number of neurologists and headache expert providers in the country. In fact, we only have less than 700 UCNS certified headache experts. Fortunately, we have many, many more general neurologists who are going to see a lot of migraine because migraine is one of the top reasons for visit to neurology. So for someone who is seeing a lot of migraine or is interested in migraine, but perhaps they don't feel like they have a lot of connections with colleagues in their institution, they may want to consider online CME or attending in-person CME. The American Headache Society, we launched a new free CME program this year called the Next Generation of Migraine Therapies. We went to 3 cities in 2019 in New York, Dallas, and San Diego, and had some great programs, and we do hope to continue that in other CME in the future. So because there's a lot happening in the migraine space in terms of therapeutics as well as understanding of pathophysiology and disease mechanisms, I encourage someone to keep up to date with not only journals but any CME offerings that are possible, especially if they feel like they are not surrounded by a lot of neurology colleagues or headache expert colleagues and maybe they feel a little bit out of the loop. That's a great way to stay up to date on the newest developments.